I'm Dr. Noelle Butler. Dr. Hillary and I graduated from Bastyr University together, and subsequently were able to work together when she started coming to Bozeman, Montana a couple of years ago. I do a lot of her body work and setup and help her with testing and other patient support. And I, in turn, have also tried NCR. I tried it the very first session that I worked with Dr. Hillary and really went into it more to find out what it was like. I wanted to know what it felt like for the patient and not so much thinking about my own health problems. And then in hindsight, after just one session, was amazed at the things that improved. And I've had subsequent visits now with Dr. Hillary. Several nervous system type things were affected. I had chronic cold sores from the time I was a young child, and I went the longest I've ever gone without an outbreak after my first NCR treatment, which was incredible. I had a left SI injury from probably 10, 12 years ago that improved incredibly. It used to flare up at least 2 or 3 times a year. Haven't had an issue since. In fact, only now in my second pregnancy has it flared up at all. I had a treatment just last night. It feels fantastic. So for me personally, it's been quite an endeavor, both to see what the patients go through and to go through it myself. I could go on and on about patient testimonies. Being a witness to it has been one of the most incredible privileges of my entire life. I have my own practice, but I don't see the incredible changes over the course of just 4 days that I've been able to witness here with NCR. So even though I do a lot of body work in my own practice, I've learned that it's definitely a slower method versus the NCR. So if I have a patient that's not responding as quickly as I would want them to body work, I want them referred here and encourage them strongly to speak to Dr. Hillary about what's going on and if NCR is right for them. So it's a tool that works on so many different levels. It's mental, emotional, spiritual, physical, all of those levels, and it really meets the patient where they are. If they need to focus just on the physical aspect of what's going on, it certainly addresses that. For others, it tends to just peel the layers of the onion as far as their life and the traumas that have occurred, so it can easily sort of take them back through and clear quite a few things that they've even forgotten about. And if they're here, then I trust that that's what they're ready for. And a lot of people, that's what happens. They come in and they go through, they get a lot more benefit than they even planned. Dr. Hillary her training is beyond belief. She trained with the founder, and she's has just practice. So she's skilled, and she's not only, it's really unique to find a physician that not only is skilled at what they do, but also can communicate with patients. She has an incredible rapport with her patients. They feel incredibly comfortable with her, and they know that when she speaks to them, she's coming from a place not only of her medical training and her own insight, but she stays on top of what's going on. And I could tell you, a lot of physicians, it's really difficult for them to do that. Dr. Hillary is a busy person just like the rest of us, but she stays on top of not only technology and how she runs her business, but also what's happening in the healthcare world. And she has a real passion for the way NCR can affect people. She wants to get into research. She wants to really make NCR known to so many more people than it is now. So that's really a testament to her passion for what she does.